Hey everyone, I'm Dr. Swati Patel. I'm a dermatologist at Mahe Clinic, and today I'm with Dr. Ansha Patel, a mental health specialist who has an extensive experience in psychodermatology from Udaipur. Hi Dr. Ansha. आज हम सुसाइड और सुसाइडल प्रिवेंशन से रिलेटेड बात करेंगे, 10 सितंबर being सुसाइड प्रिवेंशन डे. तो डॉक्टर अंशा, what exactly is suicide?
Right. So, thank you for having me here, and thanks for such a kind introduction. Just like it. Coming to your question, you had asked me what is suicide. So, see, suicide, technically speaking, can be described as an event of undetermined intent. And when we elaborate that in terms of literature and what is already known on it, we know that it can be a wish, it can be impulse. It can be an act, it can be a desire, it can be an ideation. And all of these things are in a continuum. So there is a significant body of work which says that the wish to escape or not to be there where you really are is actually noble. But the wishes to escape and not be alive versus the wishes to live sort of tend to counterbalance each other, and the wish to live would be much more than the wish to not be there. So that is how it happens in the normalcy. However, when you see it at a continuum where intentions are becoming stronger, the urges are increasing, the ideations are coming out more loudly, and the act comes up. The act is something which is seen as abnormal. Right, so it's just one single continuum where we see all these things.
The act is basically the conclusion.
Right. The attempt. The act may be the attempt, which may or may not culminate in death.
Yes. So usually डर्माट में जैसे तो I seen जिससे लोगों का mental health काफी इफेक्ट होता है with chronic disorders, जैसे कि psoriasis has no cure, vitiligo has no cure. So I've seen their mental health being adversely affected with that. Can it also lead up to suicide in some cases? Is it documented?
Yes. We know now that suicide as a form of communication, as a call for help, usually happens when a person is facing profound loss of self-esteem, loss in personal, financial, occupational terms, which tend to happen in chronic medical conditions more often. Be it dermatological or be it even general medical conditions such as HIV, cancer, chronic pains. So that does come up, and I'm sure you would have also seen cases where suicide has come up at the backdrop of a mental health condition.
Yes. I've seen patients with chronic skin conditions, psoriasis and all. They come in and they're like, what's the point? What's the point? So I wouldn't exactly call it like suicidal ideation, but I have seen them extremely depressed, very down. And I do tell them there are treatments for it. It's controllable. It's not curable, unfortunately. So that's what keeps them down a lot. And the statistics that I have come across, India may at least more than 1 lakh cases of suicide are reported in a year. But approximately 25 to 30 log they commit suicide. And we are in top 25 countries in the world.
Yes.
For suicides, not wealth, not anything, just suicide. So, what exactly are the causes? Like, क्या कारण है that the person is driven to such an extreme step?
Yeah, the causes can be multitude. 25% of all suicides happen because of significant psychological disorder or a psychiatric condition behind that. The rest 75% known, the facts are related to other financial crises, economical crises, and interpersonal conflicts, disruptions, relational losses, etc. So when we are just tapping the mental health conditions, again you can diversify them in terms of psychological disorders where you'll find adjustment issues, marital problems, problems in family of procreation, which is the family in which people are married into, and trying to adjust into. That sort of a thing may come up. Loss in relationships is also one of the major reasons. When you look at psychiatric morbidity, it is primarily suicides as a backdrop of substance dependence syndromes and polysubstance dependence. You can also have suicides in people who are having schizophrenias and other psychotic disorders, mood disorders, bipolar affective disorders, major depressive disorders. So the list is never ending.
Yeah. As a psychologist, जो सबसे common case, what have you come across? Like the most common mental health condition that has led a person to such an extreme step. Of course, you must have controlled it, you must have avoided it by counseling and everything. But सबसे commonest चीज क्या है?
I think this particular phenomena tends to have bimodal peaks.
Okay.
And somewhere in 30s, it will have one peak, which is in the early adulthood years, middle adulthood years. And then after 70s, particularly there are certain risk factors associated with that also. So what I have mostly tackled in clinical practice have been in the earlier group, and primarily in people related to very demanding academic professions, people who are having several other psychological vulnerabilities, and they tend to drop at the very verge of a certain stressor. For instance, tomorrow is my final thing and today I don't know what to do. Or since a week I've been in a dip and now I feel that I can't do it. I'm just crashing into pieces, so it's better that I finish it all together.
Yeah.
Or it happens each time with me during the time of a significant event and I can't do it. So it could be either ways, or a chronic stressor, which is like a medical condition which keeps happening and then there is no certain cure associated with that particular condition. So this is the sort of things that I've seen more of.
Like if I love someone, they whether they have a mental disorder or not, obviously. Maybe they have a mental health disorder. So how would I know they are moving towards the final act?
Right.
Maybe not a person that I love, maybe someone I work with.
Correct.
And कई बार लोग मजाक में they keep on mentioning
Right.
Like that is mazak, of course. But how do I exactly know, okay, this person is going towards the final act, is moving towards that verge, whether it be their messages, their status. Social media is also a big proponent in finding that out. How do you know somebody is moving towards the act?
Okay. Now, see, you made a very important and pertinent question. What happens to this particular phenomenon we see is that now we're moving to the second leg, which is suicidal prevention at large. Now, the first thing I think we need to understand is something which is preventable. India if not only in India, if you see across the world, if in every 40 seconds one suicidal attempt is happening, and then an attempt happens and then suicidal death, there is a gap between the two things. There is known that there will be 10 attempts before each death. That means every suicide is at least 8 to 9 times preventable condition.
Oh dear, 10 attempts before the final?
Yes. Unless it is a impulsive suicide.
Okay.
Which is a different category, a different genre altogether.
Impulsive suicide.
Right. So when we again come back to the main question, I just suggest the basic premise in which there will be 5 A's and 3 S's. Okay. So the first is one has to ask directly. Ask. Yes. Often people move back. They don't ask. They feel hesitant. Yes.
I won't ask. It's like, okay.
It's important to ask directly.
Yeah, but ऐसा नहीं लगता कि इंसान बुरा कहीं मान जाए.
Yes, but then that's the only way you can rescue from the risk involved.
Okay.
So the first thing is that you need to ask. The second thing which you can do is, or anybody can do is, assist a person in assessing the severity of the condition. What is really happening inside?
How do you do that?
Sort of let the person talk. Allow him to give some free space. give him the sense that the information will be kept confidential and he can open up and express himself as much as possible, and there is a workability around that particular issue. Right? So that's the second thing, that you have to help a person open up. The third is to get aware where your suggestions sort of come in. It is something which, once you know it's there, one has to help the person understand that now something is significant.
Okay. How do you define the example? For example?
Yeah, I'll just explain. And then I'll just explain all the steps and then we'll come back.
Of course.
And the next is, after the awareness part, once a person starts sort of thinking that something is morbid about this particular phenomena, one has to arrange the possibility of seeking help.
Okay.
That should also be available.
That is
frequent reminders is also something that can be done. Okay. The next aspect of this entire phenomena is ensuring safety, because we know that there is a person who is thinking and who might intend to do something which is dangerous to him. So safety is important here. What is also important is understanding the stigma behind the entire aspect. That it's okay to feel overwhelmed at times. It's okay to feel vulnerable at times. It's a call for help. If you just see the talk of a person who's suicidal, they want to be helped. They don't want to die.
They don't want to die. Even in Indian society in general, men are very emotionally, they are suppressed.
Yes.
They are if they ask for help or zara se dega vulnerability show.
It is not socially accepted usually.
It's not. They'll be like, oh my god, So that is not generally accepted in men, definitely. But you should let them know it's okay to be vulnerable.
Yes.
It's okay to say what you feel. It's okay to talk.
So the stigma aspect is humongous, not only in suicide, in any psychological condition or mental health condition. We lose a lot of people to appropriate intervention because of shame, blame, procrastination.
Because I've seen most of the time, just say if there is a person who committed suicide, what I hear from people around me is that he was a coward or she was a coward.
Exactly. Now you're coming to the most important point of this entire phenomena, in which you're talking about suicide survivors.
Yeah.
Right. So often we know that suicide survivors are people that you just mentioned. They are also the families.
Yeah.
Who are facing somebody who just recently attempted, or somebody that they lost.
Yeah.
So all these people need to be timely checked in, approached, screened, assessed for the risk involved, or the intent and the lethality, and then intervened.
So if I know someone who has lost someone very close to them, and if I know they're more depressed and if they're on the verge of it, I should encourage them to consult a specialist, a mental health specialist.
Yes.
So how do we go about that? As a doctor, if I come across people who are depressed, who I know are clinically depressed and who have some mental health issue. So this few times that I did suggest कि आप एक mental health specialist को consult करिए, because उनके hair fall this so suppose 10-15 साल से चल रहा है, या chronic itching है उनकी 15-20 years से है. So I asked them to see a mental health specialist or just get counseling. Some people actually get very annoyed and they get very angry. They are pagal sometimes. How do we get around that stigma as a doctor? How do we approach these patients? Okay, can you make some suggestions?
I think one thing which is very important, which one can do, is normalize that experience.
How do we do that?
What we usually do as mental health professionals in our clinics is that we explain it to them that depression is something which is happening. 1 in every 10 is depressed. Anxiety is 1 in every 7. And the phenomena is only increasing.
Yeah.
Which means that in today's day and scenario, 1 in every 3rd or 4th home is having someone who needs help, who is at that verge of slipping here or slipping there. In joint family setups, you will have 2-3 people in the entire network of residing within the same house who are sort of subclinical, might not fall morbid, or people who are morbid. So one important aspect is normalizing that. The second thing is reiterating the need for help. And they might not come to us very directly at the first instant, but if they do keep coming to you, then you can keep reiterating, and then the link between the mind and body healing and holistic healing of the person. And those things can be tapped upon, and I'm sure people do. If there is an availability of a specialist available at hand, people do seek it. But then it is a sort of a bumpy pathway.
Absolutely, it's not easy.
And there's a lot of literature which also says that people who are from lower SES backgrounds are more open to help seeking. When we add components of education and sophistication and wealth to it, the help seeking dips substantially.
Basically, it's okay to not be okay. We have to basically normalize that. Thank you, Dr. Ansha, for your time, for so much information. Thank you so much for coming.